What would you do if you were told that you only had a few months to live? You are in constant pain, breathing through a tube, cannot control anything, and you just want to die. Wouldn't you want to die a much quicker and less painful way? Physician-assisted suicide allows you to die much quicker to relieve the pain and suffering the patients are going through. Assisted suicide is legal in 7 states as of right now, and they are California, Oregon, Hawaii, Washington, Montana, and Vermont. Assisted suicide should be legal in all the states, and here are the reasons why. When people hear the term assisted suicide, they don't generally think of it as a good thing. I remember when I thought of the word or term assisted suicide, I didn't think it was a good thing either until I had a family member or loved one in the hospital in serious pain and suffering, and they just wanted to die. When you're in that position, you come to realize that having your loved one suffering is not very humane, and you just want the pain to stop. This is where assisted suicide comes in. It may affect the family, however, it will affect the patient more. The patient will not be lingering in pain and every morning say, "Today I want to die." They will be in a much happier state knowing that they will die soon and that they can leave the world with dignity. Sure, assisted suicide affects the family because they lost a loved one, but they should come to realize that having to lose a loved one is better than having their loved one suffer. I wouldn't want to watch someone that I know saying they want to die every single day. No one wants to hear those words from someone they love so much. Other people are against assisted suicide and want it to stay illegal. There are some reasons why people think it should stay illegal. According to BBC, the main reason why people are against it is for religious reasons. I say that no matter what your religion is, who you believe in, and just because you want to end your life sooner than expected does not mean you are a huge sinner and that you're not going to continue going into heaven. Making assisted suicide will not only relieve the pain and suffering for patients, but it does follow the Death with Dignity Act. To even be able to be eligible for assisted suicide, there are lots of steps and protocols you have to take. The patient must have at least 6 months or less of living, and they must have a terminal disease. They cannot have any mental illnesses that can affect their decision whatsoever. 2 witnesses have to sign a paper, and at least one of them has to be pretty much a stranger. They cannot know you or even be a family member. Along with that, there is multiple doctors that examine you to make sure that you are eligible to get assisted suicide. This process is very long and secured, but it is good because it's just making sure that this is what the patient wants and they're getting it for a reasonable reason. Some people say miracles can happen, and I said yes, they can happen. But when it comes to terminal illnesses, majority of people do die. The nurses end up seeing the patients suffer and in pain. This is why over 50% of the nurses do want to legalize assisted suicide. There are also candidates who actually moved to a state who already legalized assisted suicide. One of the most well-known cases is 29-year-old Brittany Maynard. That's Brittany. According to CNN, Brittany was diagnosed with a brain tumor in 2014 and was given 6 months to live. She could have gotten a full brain radiation, but it would have ended up burning her brain in the first degree. She knew if she took this path, the quality of her life would be gone, and that is why she chose the assisted suicide pathway. However, before she even considered being a candidate, she did move to Oregon, which was one of the 5 states at the time that did legalize physician-assisted suicide. After she was accepted, she got to spend the rest of the time with her family preparing to say her final goodbyes. The final goodbyes happened on November 1st in her Portland home right beside her family. Physician-assisted suicide should be legalized in all states. It makes the family member relieve that their loved one is no longer in pain and suffering, and that they're in the place where they want to be. If assisted suicide does not become illegal, there is going to be a lot of people in pain and suffering watching their loved ones suffer. Physicist assisted suicide is not the easy way out, it's just leaving the world with dignity. The two articles I use, and the titles are Ethics, Anesthesia, Religion, and Anesthesia. The date published was 2014. The publisher was BBC. The other article title is My Right to Death with Dignity at Age 29. Date published 2014. The author Brittany Manor herself, and the publisher was CNN. Thanks for listening.